Hi everyone, my name is Megan Rorabeck. I'm a pelvic floor physical therapist, and in this video I'm going to talk about issues that we might be experiencing down there when we're riding our bikes. Men have a pelvic floor as well, so we just have to keep that in mind. But regardless if you're male or female, it's not normal to have issues down there when you're cycling. And also, it is really important that you do get a good bike fit and have a good saddle, because those two things can contribute to feeling pain or discomfort. So some people think that a really cushioned saddle might be more comfortable than one that is more sleek and slender. However, that is not exactly true, because a saddle that has more cushion on it will actually get in the nooks and the crannies of our pelvic floor, which will restrict blood flow to this area. And that is not good, because we know that blood carries oxygen and nutrients, and when we're exercising, our muscles in our body especially needs oxygen and nutrients. So a super cushioned saddle will be more restricting than one that is sleek and slender. So the best bet would be to get fit for a saddle that fits you width-wise between your sit bones, and we'll talk a little bit more about that. But a sleek and slender saddle with a good pair of cycling shorts that have a good chamois in it would be your best bet. So what we want to do now is talk about a couple common ailments that we might experience. So the first thing would be chafing. We've probably all experienced it at some point. There's a bunch of different creams that you can get. Play around, see which you like best, but when you're applying it, you want to apply to the area where your thigh meets your pelvis, and you want to put it from the front all the way to the back, under the glute or the butt cheek muscle. Use more than you think you might need. It's better to have too much than not enough and have the chafing. The second thing, numbness or tingling. So we know that this area, like I said before, if you have a more cushioned saddle, that's more compressive to your soft tissue, which will inhibit blood flow, which then can lead to numbness or tingling. So sometimes we might experience numbness kind of right below the pubic bone. Over our pelvic floor muscles sit what's called our labia. Those are the flaps of tissue. So a super cushioned saddle can be constricting to the labia. And then also more of a specific diagnosis with the numbness and tingling that is more common in cyclists. It's called pudendal neuralgia. So that's where our pudendal nerve runs just to the inside of our sit bone on each side, and then it branches into three. From this point, it branches up to the clitoris, medial to the perineal body right here, just the area between the vaginal and rectal opening, and then the posterior branches to the rectum here. So sometimes when that nerve gets compressed, we can have numbness or tingling through this whole general area from that nerve being compressed. So that's a more common diagnosis that you might experience too. The third thing that we want to think about is coccyx pain. So our coccyx, or our tailbone that sits in the back, has our third layer of pelvic floor muscles that specifically attaches there. And sometimes we can have a muscular imbalance between our pelvic floor and our glutes. Our pelvic floor will pull our tailbone forward towards our pubic bone, and our glutes will balance that by almost pulling it backwards, the opposite direction. So if we have an imbalance between our pelvic floor and our glutes, that can be tugging on our coccyx or our tailbone, contributing to pain. We also need to think about is how is our pelvis positioned on the bike. If we're positioned really, really upright or even slouched backwards, more of this position, that will put more pressure on our tailbone, so it's essentially a little bit more hooked, and that can be uncomfortable as well. We also know that our tailbone attaches to our sacrum here. That's a joint, and sometimes that joint can be really stiff or it can move too much. So that can be contributing to tailbone pain as well. The next thing we need to look at are the sit bones. So the sit bones, sometimes we can have pain through that area when we're cycling, and that leads back to our saddle width. So if our saddle width is too wide or too narrow, that could be putting extra pressure right through our sit bones. Back to the numbness or tingling, we know our pudendal nerve runs right through here, so that can almost lead to this kind of fiery feeling through our sit bone area. And then also looking at what kind of cycling shorts are you wearing. Is there a good chamois? Because that can lead to, if it's not a good one, lead to some chafing right through this area as well. Another common thing we might experience could be back pain, and that can again be to muscular imbalances through our core, our back in the front, if we're not stable through here. Again, because our lumbar spine, our low back, and our sacroiliac joints, they're joints and they're meant to move, so if they're too stiff or too mobile, that can also lead to pain. However, all of these diagnoses or issues that we talked about, none of them are normal, no matter how far you're riding, whether you go for 5 miles or 100 miles. So if that's the case, I would really recommend looking into getting a professional bike fit. And if you're still having pain, consider seeing a pelvic floor physical therapist to take a look at specifically what is going on with you and your needs while you're on the bike. So hopefully that helps you all kind of deciphering what's normal, what's not. If you want to learn more, give me a follow on social media. I'm at Between the Hips.